The article I chose is called Dr. Drew Blastfellow Doctors for Fueling the Opioid Crisis in a New Documentary. It was published by Fox News October 10th, 2019. It was written by Matt London. In the article, Dr. Drew Pinsky is a outspoken voice in the medical field. He calls out the doctors for what he says fueling the opioid crisis. Dr. Drew is known to many from the popular talk show Loveline and Celebrity Rehab. He's blaming doctors for errors made in opioid management. One of the other things he discusses is the maker of OxyContin, Purdue Pharma, and its owners, the Sackler family. And they had reached a tentative deal with dozens of states and local governments over the company's role in exacerbating the crisis, which has been linked to more than 400,000 deaths in the United States. And there are hundreds of lawsuits aiming to hold them accountable for the opioid epidemic. Part of the reason that the opioid epidemic has gotten so bad is that he believes things like creating the fifth vital sign as the pain level as the fifth vital sign. He said there's not a fifth vital sign, that pain cannot be measured objectively like a heart rate and a blood pressure. So a nurse cannot treat it that way. Gave the example, two different patients could have the same procedure, the same body type, the same age, but in reality have different pain levels because everyone is different. It's more of an opinion than something that can be measured by the nurse. One of the other things that's caused the epidemic is the patients want a quick fix. They want to be out of pain, and whatever they have to do to get it, that's what they want. So initially, doctors just prescribed opioids as the quick fix because it was considered a miracle medication. And it did fix it, but it also caused the patients to need it and became addicted to it. So while patients continue to complain about their pain and that it wasn't working in the hospitals, then insurance companies started not wanting to reimburse the hospitals because of the fact that their patients weren't satisfied with their care. So that started to show an effect on when the doctors prescribe medications also. So in all reality, when Dr. Pinsky saying that the doctors are the reason and the fueling the opioid crisis, it was really, in my opinion, the patients who fueled it because they did everything they could to get what they wanted and threatened to sue doctors. There were civil suits cases brought up against doctors for inadequate pain control. And so this scared the doctors into prescribing the medications so that they wouldn't get sued. And this caused the patients to get addicted and even overdose and kill themselves. So we as nurses have to deal with this type of problem on a daily basis. We get yelled at, cussed at because we can't give them anything else for pain because now the government has cracked down on the opioid crisis, but we've already got all these people addicted, and now we're having to rehab these patients and get them off certain opioids and on other medications to survive. But so now we're stuck trying to give these patients an alternative method of pain management. And for this project, I chose acupuncture as my non-opioid pain strategy. I chose it because I've known people personally, several patients and coworkers that have actually used the method, and it's been successful. So over 1.5 billion people worldwide suffer from some type of chronic pain, and 3 of the most common are back pain, neck pain, and severe headaches or migraines, which a lot of us suffer from. These are all pain issues that people deal with daily, and it affects their lives, so they want to be able to fix it. Sleeplessness, long hospital stays, increased outpatient visits, and overall decreased ability to function are all side effects of chronic pain. So most people turn to drugs, but drugs are not the answer. Most medications only mask the symptoms anyway. They don't fix the problem. So acupuncture is widely known for its effectiveness in pain treatment. Some of the most common pain complaints that it treats are low back pain, neck pain, and headaches, which are the most commonly complained about. In a 2-year survey of over 89,000 patients, 93% said their acupuncturist was successful in treating their musculoskeletal pain. Acupuncture activates a number of the body's own opioids, as well as improving the brain's sensitivity to the opioids. So with acupuncture, your body is using its own natural endorphins and relieves the pain and decreases your anxiety and everything. Many people already use acupuncture as a method for relaxation, but we just need to educate some of these other clinics, pain doctors, that acupuncture is an effective pain management strategy. I did my handout, if you can see it. It's on acupuncture. Let's see. I said why. I'll put a link on there so that y'all can see it better. I said, what is acupuncture? And acupuncture is a technique in which practitioners stimulate specific points on the body, most often inserting thin needles through the skin. And it's one of the practices used in traditional Chinese medicine. That's where it was originally started. And I asked the question, did you know acupuncture can help reduce many types of pain: migraine and tension headaches, chronic low back pain, knee osteoarthritis, neck pain, postoperative pain, cancer pain, as well as nausea, anxiety, and depression are also things that many people suffer with that acupuncture can help. Things to consider are that you may have to have multiple treatments to get relief. Make sure that you investigate and find a trained professional and look at their credentials before going to an acupuncturist. And also, acupuncture may not be for you if you have a bleeding disorder, are pregnant, or have a pacemaker. And with the pregnancy, it depends on where your pain is. You may still be able to have the treatment, but you need to talk to your physician first. And then just remember, acupuncture can be used to treat many types of pain. So it can help a lot of people to get pain relief. The target audience for the acupuncture would be adults who are being treated at a pain clinic. those people that are suffering from chronic pain that are interested in an alternative pain reliever. Most of the patients have been prescribed pain medicines or opioids, but would like to try an alternative therapy. And some people are just trying to not have to take as much pain medicine, so they'll use it. And a lot of people suffer from anxiety or depression as well, so it kind of lets you do 2 or 3 things at one time. The goals of the teaching, the outcome, is at the end of the presentation, the patient family will be able to accept acupuncture and participate in acupuncture as an alternative treatment to certain types of pain. The cognitive learning objective is the patient will be able to list 2 benefits of acupuncture for their chronic pain, and the patient will be able to explain what acupuncture is. Effective learning objectives are the patient will accept information material to read for further education, and the patient will begin looking for a good acupuncture therapist in the area and investigate. Psychomotor objective is that the patient will observe an acupuncture video to know what to expect at a visit, and that the patient will make an appointment to have acupuncture before their next doctor's visit. Evaluation and techniques. Cognitive learning will have occurred if the patient can explain what acupuncture is and understand if it will relieve their pain issues. Effective learning will have occurred if the patient accepts the information and begins researching acupuncturists. And then psychomotor learning will have occurred if the patient watches a video and schedules an appointment. And that is all I have. Thank you.